Good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, all speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing now with opening remarks from Mayor Jim Kenney. Mayor, you now have the floor.
Thank you very much. Good afternoon, everyone. Yesterday, we brought you information about city services for the Memorial Day weekend. Today, we look beyond that with some updates about summer programming. We are working hard to modify summer programming to ensure public health while still delivering recreation and employment options for all Philadelphia children and youth. One program that's moving forward is the Parks and Recreation Play Streets program, which distributes meals to thousands of children each summer. Activities for youngsters at Play Streets will align with reopening guidance at the time to ensure their health and safety. We are calling on community leaders, faith-based organizations, and nonprofits to help make sure young people have access to safe, nutritious meals close to home this summer. You can do so by signing up to become a volunteer Play Street supervisor. Volunteers must be available to close their street to traffic each weekday from June 15th through August 25th and distribute grab-and-go meals to local kids at noon and 3 p.m. each afternoon. The deadline to apply is Friday, June 5th, and residents can learn more at phila.gov/playstreets. That's phila.gov/playstreets. The city and its partners will continue to operate grab-and-go meal distribution and food sites during the summer, though some locations and schedules may change. Residents are encouraged to visit phila.gov/food or call 311 to find up-to-date food distribution information. That's phila.gov/food. Meanwhile, we are developing plans to offer a modified summer day camp season if the health situation allows. Programming would focus on providing safe, accessible places for children to play during weekdays. If a camp season is not possible this year, Parks and Recreation is planning other opportunities for city's young people. Unfortunately, City Swim for Life and theme camps will not operate this summer. More details about the city's camps will be available in early June. And residents can stay up to date by visiting phila.gov/parks and recreation. That's phila.gov/parks and recreation. By the way, Parks and Rec plan to hire 285 youth and young adults this summer through the Pennsylvania Department of Labor and Industries State Local Internship Program, or SLIP for short. This program is managed locally by Philadelphia Works and the Philadelphia Youth Network. Older teens and young adults can learn about how to apply at phila.gov/programs/work-ready at Parks and Rec. That's phila.gov/programs/work-ready at Parks and Rec. The city's Office of Children and Families out of school time summer programs have shifted to be virtual until further notice. Online activities will include read aloud videos and literacy supports, virtual college and industry tours, dance and martial arts, and mindfulness meditation, and a mindfulness meditation practice, which apparently I need. One more summer programming note: the Free Library Summer of Wonder this year, Summer of Wonder, will offer virtual programming from June 1st to August 31st. Children, teens, and adults can go online at freelibrary.beanstack.org. That's freelibrary.beanstack, BEANSTACK-org. The Free Library is also partnering with local organizations to host pickup spots for materials and activities. More information on locations will be coming soon. So this summer, more than ever, neighbors are relying on one another to help our kids and families get through this tough time. Whether it's volunteering to provide free meals at a play street, encouraging a young person to apply for Work Ready, or finding a safe summer experience for your child, we must all do our part to help our young people have a healthy summer. I mentioned earlier this week that tonight at 7 o'clock, we are hosting PHL Love, a variety show to support the PHL COVID-19 Fund. As a sports fan, I'm excited to share with you that some of Philadelphia's favorite sports stars, Bryce Harper, Shane the Flying Hawaiian Victorino, and Joe Girardi, will be joining the show. Country star Tim McGraw will offer some words of hope as well. I hope you will join us too. You can watch the show on several of our local TV and radio stations or online at inquirer.com and radio.com. Go to phlcovid19fund.org to learn more and donate. Now I will turn it over to Dr. Farley for his daily update.
Thank you very much, Mayor. Just a quick update today. We're continuing to make progress against the epidemic. As far as cases, we've had 341 new confirmed cases in Philadelphia residents since this time yesterday, bringing us to a total of 20,700 since the beginning of the epidemic. Now, we got many laboratory reports in today, which probably explains that higher number. If you look at the graph on our website, you can see overall we're still seeing a downward trend in the number of cases per day overall. We're continuing to make progress on our clusters in congregate settings. 0 new cases in the city's jail since yesterday. Just to remind everybody that the jail is starting up screening of all inmates. And when we do that, we do expect that we will find more cases just from that screening. In the city's hospitals, we have now 623 inpatients with the coronavirus infection in Philadelphia and 1,202 in the Southeast Pennsylvania region. Those numbers are about the same of where we've been the last couple of days. As far as deaths, we have 13 new deaths to report today, to bring us to a total of 1,165. Of those, 629 or 54% for nursing home residents. Let me just remind everybody again that in testing, which in the past we had restricted because we had limited availability, now is much more widely available, 47 sites across the city. If you go to www.phila.gov/testing, you can see all the different sites. We would strongly encourage anyone with a new onset of respiratory symptoms to go to one of these sites and be tested. Even if you're not sure, just go ahead and be tested. If it turns out you have the infection, then we can help you take steps to make sure that the infection is not spread to other people. We are getting closer to reopening. Again, we still don't have a date as far as when we will be reopening. But as I said before, and I want to just continue to repeat because it's so important, that wearing a mask when you're around other people and out and about is going to have to become the new normal. So if you don't have a mask already, get a mask, get used to wearing it. www.phila.gov/COVID is our website with all of our information. Thanks.
Great. Thank you, Dr. Farley. We are now going to turn it over to Armando, who will read the Spanish language translation of both the mayor and Dr. Farley's remarks. Armando.
Mensaje del alcalde Jim Kenney para el jueves 21 de mayo del 2020. Buenas tardes a todos. Ayer les brindamos información sobre los servicios de la ciudad para el fin de semana del Memorial Day o Día de Remembranza. Hoy tenemos algunas actualizaciones de nuestra programación para el resto del verano. Estamos trabajando arduamente para modificar esta programación para poder garantizar la salud pública y al mismo tiempo ofrecerles opciones de recreación y empleo a los niños y jóvenes de Filadelfia. Un programa que sigue en marcha aún es el programa del Departamento de Parques y Recreación llamado Play Streets, que distribuye comidas a miles de niños cada verano. Las actividades para jóvenes en Play Streets se adaptarán a las pautas vigentes de reapertura para garantizar su salud y su seguridad. Hacemos un llamado a los líderes comunitarios, a las organizaciones religiosas y a las organizaciones sin fines de lucro para apoyarnos a garantizar que los jóvenes tengan acceso a comidas nutritivas cerca de sus hogares este verano. Y pueden hacerlo convirtiéndose en un supervisor voluntario de Play Streets. Los voluntarios deben estar disponibles para cerrar su calle durante cada día laboral del 15 de junio al 25 de agosto y distribuir comidas para llevar a los niños al mediodía y a las 3 de la tarde cada día. La solicitud es este viernes 5 de junio y los residentes pueden obtener mayor información en phila.gov/Play Streets. Asimismo, la ciudad y sus aliados continuarán operando centros de distribución de alimentos durante el verano, aunque algunos lugares y horarios pudieran cambiar. Se sugiere a los residentes a que visiten phila.gov/food o llamar al 311 para encontrar información actualizada sobre la distribución de los alimentos. Mientras tanto, estamos desarrollando planes para ofrecer una temporada de campamentos de verano diferente si y solo si la situación de salud lo permitiera. La programación buscaría proporcionar lugares seguros y accesibles para que los niños jueguen durante la semana. Si la temporada de campamentos no fuera posible este año, el Departamento de Parques y Recreación está planeando otras actividades para los jóvenes. Desafortunadamente, City Swim for Life y los campamentos temáticos no funcionarán este verano. Hay mayor información sobre los campamentos de la ciudad que será disponible a principios de junio y los residentes pueden mantenerse actualizados visitando fila.gov/Parks and Recreation. Por cierto, el Departamento de Parques y Recreación planea contratar a 285 jóvenes y adultos jóvenes este verano a través del programa de pasantías estatales y locales del Departamento de Trabajo y Industria de Pensilvania, o LSIP por sus siglas en inglés. Este programa lo administra localmente Philadelphia Works y la Philadelphia Youth Network. Los adultos jóvenes pueden enterarse sobre cómo postular en fila.gov/programs/workready@parksrec.com. Los programas de verano fuera de la escuela, es decir, out of school time, de la Oficina de Niños y Familias de la ciudad, desde ahora serán virtuales hasta un nuevo aviso. Las actividades en línea incluirán videos de lectura en voz alta y apoyo a la alfabetización, visitas virtuales a universidades e industrias, danza, artes marciales y sesiones de atención y meditación. Quisiera agregar un comentario adicional sobre nuestra programación de verano. El Summer of Wonder de la Librería Pública de Filadelfia de este año ofrecerá su programación virtualmente desde el 1 de junio al 31 de agosto. Los niños, adolescentes y adultos pueden conectarse en línea con la biblioteca yendo a freelibrary.beanstalk.org. La biblioteca pública también se está asociando con organizaciones locales para organizar lugares de recolección de materiales y actividades, y pronto habrá más información sobre este tema. Así que este verano, más que nunca, los vecinos deben apoyarse mutuamente para ayudar a nuestros niños y familias a superar este momento difícil, ya sea como voluntario para distribuir comidas gratis en Play Street, o alentando a jóvenes a buscar empleo a través de Work Ready, o al encontrar una experiencia de verano segura para su hijo. Todos debemos hacer nuestra parte para ayudar a que los jóvenes tengan un verano divertido, seguro y saludable. Finalmente, como mencioné a principios de esta semana, esta noche a las 7 de la noche presentaremos PHL Love, un programa de variedades para apoyar al Fondo PHL COVID-19. Como fanático de los deportes, me emociona compartir con ustedes que algunas de las estrellas del deporte favoritas de Filadelfia, como Bryce Harper, Shane Victorino y Joe Girardi, estarán presentes en este espectáculo. La estrella de música country, Tim McGraw, también nos dará sus palabras de aliento durante el show. Espero que nos acompañe y sintonice este concierto. Puede verlo en varias de nuestras estaciones locales de televisión y radio o en línea a través del Inquirer.com y radio.com. Y si está dentro de sus posibilidades, por favor, vaya al Philadelphia Cough F9F Fan.org para obtener más información y para hacer su donativo. Y esta es la actualización en materia de salud para el jueves 21 de mayo del 2020. Desde ayer se han confirmado 341 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 20.700 casos en la ciudad. Muchos laboratorios nos enviaron sus resultados el día de hoy, pero aún así la tendencia es al descenso de los casos. También hemos hecho avances en la evolución de los casos en los entornos grupales. No tenemos nuevos casos del COVID-19 en las cárceles y actualmente reportamos 3 casos confirmados. Sin embargo, esperamos encontrar más casos en las cárceles con la implementación de las pruebas masivas. Hoy, tristemente, reportamos 13 muertes por la COVID-19 en la ciudad. Un total de 1.165 personas han muerto por la COVID-19. 629 o el 54% de estas muertes han sido en hogares de ancianos. Hay que recordar de que este virus no discrimina por raza o por género. Informamos que hasta ayer en la tarde 623 personas han sido hospitalizadas en Filadelfia y 1.202 personas en la región del sureste de Pensilvania. Las pruebas siguen disponibles en 47 centros ubicados a lo largo y ancho de la ciudad de Filadelfia. Y usted puede encontrar el centro más cercano a su domicilio en fila.gov/testing. Les alentamos a todas las personas de cualquier edad que presenten fiebre o problemas respiratorios a realizarse la prueba del COVID-19. Les recordamos que las pruebas están disponibles con cita previa. Y estamos próximos ya a la reapertura de nuestra hermosa ciudad. a medida que nos acercamos a la fase amarilla, vamos a tener que acostumbrarnos a normalizar el uso de las mascarillas o cubiertas faciales al salir de casa. Hay que recordar que mi máscara te protege a ti y tu máscara me protege a mí, así que úsala, porque solo juntos podremos superar este gran reto. Muchas gracias.
Thank you, Armando. We are now going to move to the Q&A portion for members of media. Please remember, we do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions. Reporters are also asked to limit their questions to 3 or fewer. We will do a second round if time permits. For those logged in today, please use the raise your hand feature, which can be found under the participants list. We also ask that you use video to ask your question if you are able. And we will now unmute reporters one by one to ask questions, starting with Shaira Arias of Telemundo.
Hi everyone. Armando, ¿me escuchas?
Por supuesto, Shaira. Bienvenida.
Ok, la pregunta es la siguiente. ¿Cuál es la situación ahora mismo con las personas que están durmiendo, que son personas desplazadas en el aeropuerto internacional de Filadelfia? ¿Alrededor de cuántos de ellos están durmiendo en el aeropuerto?
The first question has to deal with the situation of those homeless and displaced people who are sleeping at the airport in Philadelphia. And my question is, how many people are doing that now?
So those numbers are currently changing. I believe overnight there were about 100 individuals at the airport.
Estas cifras continúan cambiando, pero me parece que anoche había alrededor de 100 personas durmiendo en el aeropuerto.
Okay. Es cierto que posiblemente tan pronto como mañana, y si no es mañana, pregúntales que cuándo será que ellos planean mover estas personas para un centro, un shelter, ya sea aquí en Filadelfia, y si en dado caso lo van a hacer, planean hacerle a ellos todos la prueba del COVID-19 antes de moverlo de aquí del aeropuerto de Filadelfia.
Y quisiera saber si es cierto que empezando el día de mañana o lo antes posible se va a trasladar a estas personas a refugios dentro de Filadelfia, y de ser así, ¿cuál es el plan? ¿Se les va a administrar la prueba del COVID-19 antes de mudarlos? ¿Es esa tu pregunta, Sharia?
Sí.
Bien. Is it true that tomorrow or soon thereafter there's plans to move people to shelters within Philadelphia? If that's the case, what is the plan? Are they going to be tested before being moved to shelters?
So we are planning to move those individuals to shelter. And we are in discussions with the advocates on timing and considering taking their concerns under consideration, and certainly recognize that they would like us to test every individual before moving them into congregate care. There's some challenges to that about where do those individuals go before test results return, but certainly have heard the advocates and taking their concerns under serious consideration as we finalize plans.
Por supuesto que tenemos planes para trasladarlos a refugios, pero estamos teniendo conversaciones con los promotores de sus derechos para ver con respecto a la mejor oportunidad y el momento para poder hacer esta transferencia. Y por supuesto tenemos intención de administrarle las pruebas antes de trasladarlos a un cuidado de entorno en grupo. Sin embargo, hay retos para ello también, porque no sabemos dónde pueden estar hasta que salgan los resultados de las pruebas, y estamos en contacto con sus promotores y defensores para coordinar esto.
Okay. Y por último, yo hablé con una de esas organizaciones y me dicen que estaban circulando posiblemente como demandar a la ciudad porque sienten que no han manejado la situación de las personas desplazadas de la manera que ellos piensan que se debió de haber manejado. Pregunta para Brian si ellos saben sobre esta posible demanda, si tienen algún tipo de información que le quieren proveer al público sobre esto, y no sé, cualquier mensaje que ellos tengan debido a que esto es lo que se está hablando y se está circulando.
Y Shaira, cuando hablas de una demanda, estás hablando de una demanda judicial, ¿verdad?
Como que ellos quieren demandar a la ciudad, correcto.
Bien. I spoke to some organizations in regards to this topic, and some of them are having conversations about having a lawsuit be brought against the city for the way that they handle the situation with the homeless people. Do you know if that's possible, that there will be a lawsuit put forth? And what is the message that you would want to send out to the public and to their defenders in regards to this matter?
So we are aware that advocates are considering a lawsuit. We're optimistic we're going to be able to avoid that. I think the city is trying to focus on the safety of everyone involved here. So the safety of the employees that work at the airport and the people who work at the airlines and those that will need to use the airport in the near future, as well as the safety of those that are unsheltered. And we're trying to balance both needs in order to come to resolution here. And I think the advocates understand that we are doing our best to do that. I also understand and respect what their position is as well. We are able to resolution without any
conscientes de lo que los promotores y defensores de estos grupos buscan con una demanda judicial, pero tenemos optimismo de que vamos a evitar esto. La ciudad está tratando de hacer todo esto dentro de los protocolos de seguridad con todos los involucrados. Por supuesto, estamos pensando en los empleados que trabajan en el aeropuerto, los empleados que trabajan para las líneas y los usuarios de estos servicios también. La seguridad es nuestro primer objetivo y encontrar refugios que se esas necesidades sería una resolución. Estamos conscientes que estos promotores y defensores comprenden nuestra situación y que estamos haciendo lo mejor que podemos para comprender sus necesidades. Tenemos confianza que debamos llegar a una resolución de todo este problema sin intervenir por la justicia.
Gracias, Armando. Thanks, Brian.
Gracias, Armando.
Thank you.
Thanks, Shara. We're going to go to Jack Thomas Metro now. Jack?
Yes, this is for Brian Abernathy. Are you providing details on the city layoff? This will be affected.
No, we're working on gathering all that information. Council has also asked for that information, so we're certainly going to share it with our elected leaders, and then we'll make sure that it's available to the press as well.
And this question is for the mayor. Speaking of council, some members of council, have expressed reluctance about raising taxes, no matter how small the increase would be. What's your message to them?
Well, first, let me frame it for you. $650 million problem. $50 million is, we were requesting $50 million in increased revenue, which includes an increase for the school district, not for the city, and a tax on a non-resident wage tax, people work in the city, and a tax on parking. The rest of it is being dealt with through cuts, layoffs, and other belt tightening measures. Certainly, council has a role in this, an important role in this. And if council feels that they want to find the money somewhere else, they are certainly have every right to put that forward. The problem is that it has to be real, because it's easy to throw stuff out there which really doesn't amount to anything. It has to balance the budget, which we're required to do. Unlike Washington, we need a balanced budget and a balanced 5-year plan. And as long as it doesn't jeopardize our long-term fiscal health. So, for example, it's been suggested that we strip down the fund balance to nearly zero. That is a really bad idea and a bad mistake. So I'm going to resist anything like that. But if there are reasonable suggestions that balance the budget, that make sense and are doable, that's what this budget process is all about. So let's see what they move forward. It's done in a camaraderie, in a cordial situation. This is not a banging heads between council and the mayor's office. And at the end, we'll have a budget product that will be difficult. It'll be sparse, but it'll be balanced, and our 5-year plan will be balanced, and we'll move forward to try to recover.
Thank you, Mayor. And this last question is for Dr. Farley. Earlier, you said that we're getting closer to reopening. how close? I'm not looking for a date, but what are you watching for in determining the reopening process? What metrics are you looking at?
Well, we would look at our case rate, and we look at the decline in our case rates. That how fast it's falling is as important as to what level it's at. And we look at whether we have hospital capacity, so that if cases were to start to rise again, our hospitals could handle that load. And we look at our ability to contain the virus at the low levels it's at, for example, our contact tracing program. So those are the things we're looking at to see how ready we feel we are. It's ultimately up to the governor, but we're certainly looking at those indicators.
All right, thank you.
Thanks, Jack. We're going to go to Sean Walsh now of the Inquirer. Sean?
Thanks very much. Mayor, at today's City Council hearing, Councilman Jones passed a resolution to allow them to do hearings on how to reopen, and he talked about restaurants that were in jeopardy of not reopening because of the financial situation. And he said, quote, "What I mean to call for in this resolution is more soft rollout openings." What's your reaction to that, do you think?
I would have to talk to Councilman Jones to find out what the definition of soft rollout openings are. Certainly, we understand the severe difficulties that our hospitality industry and restaurants are going through right now. Sad, though, that the most difficult industry to deal with relative to this virus is an industry that brings people together across a table or next to each other on a bar and allows for the most possible opportunities for the transfer of the virus from one person to another. If we can work out those details and the numbers look good, and we don't see the worst thing we can do, and this is what I'm afraid of when it comes to Florida and Georgia and other places that are Michigan, their people are pushing to open. If we have a major surge in September, October, November, we could be right back where we were in mid-March, late March, or worse. And it's not worth it to jump ahead precipitously unless we know for sure, or we know at least at a great percentage that we're not going to create another surge. So I miss restaurants too, and I miss going out. But we have to be thoughtful, sure, and scientific about what we do and how we do it. And hopefully we're going to get there hopefully as soon as possible, but not sooner than we can.
Thanks. Dr. Farley, there's been reporting about, I think at the state level, combining of testing for the virus and for antibodies to the virus and the problems that has caused. Can you comment on that issue and whether this is an issue in Philadelphia?
We don't do that here. So the numbers that I'm giving you are people who have a positive test for the virus itself. It's using with a technology called PCR. So we know the virus is there. We have received some small number of cases of a positive antibody test, classifying those separately, and those are not in our statistics.
Gotcha. Has testing results that combine those elsewhere caused problems with working with the city data or interfacing, or no? No, we have our own data. So I would consider combining those a mistake. If that mistake is made elsewhere, it's not going to have an impact on us. Okay, thank you. That's all I have.
Great, thanks, Sean. Next up, we have Lauren Make with NBC 10. Lauren?
Hi, all. My question is regarding Little League and youth sports. Little League just put out some new guidelines for leagues around the country with things like no high fives, no sharing snacks. And I wanted to ask Dr. Farley what parents should keep in mind in terms of whether it's okay and safe for their kids to go back to sports like that. And in addition, along the same lines, Dr. Farley, I listened to a roundtable this morning that was hosted by Senator Pat Toomey, the president of Little League, was on that roundtable. And there was also a doctor who was saying that it is unlikely that kids would spread COVID-19 to their parents. So unlikely they would have it on the field and then go home and spread it to their parents. And I wonder your take on that and whether that fits with research you've seen.
So first, we think that youth, organized sports for youth is really important overall. We want to get back to that. It's not clear when we're going to get to that point here in Philadelphia or in Pennsylvania. whenever we do, we will have some specific guidance for how it can be done in a safe way. And it'll be some efforts to reduce the number of children who are coming in contact with each other and put as much distance as possible. As to the larger question about how likely children are to spread this amongst each other and then to adults, there's really a lot of that's unknown about that. We know that children in general are much less likely to get sick with this infection. It's less clear how often they get the infection with no symptoms, or whether they can spread it or how much they can spread it without symptoms. And so, we may, because the most of them don't get sick, it's tempting to say we don't need to worry about them. On the other hand, with influenza, we know that children often don't get sick, but then they are a major route for transmission to adults at home. And so we need to be careful about that. I hope we get more information as we get closer to this, but I can say when we get to youth organized sports, whenever it is, we'll have some very clear guidelines for parents and for coaches.
Thanks, Dr. Farley.
Thanks, Lauren. We are going to go to Marcus Espinoza now with Fox 29.
All right. Hey, folks. My question's regarding homeless really in Center City and Old City. I've had people reach out to me and folks at our station about a severe lack of police presence on Market Street in Old City, especially at night. And that there's a fear for some folks who are walking outside after work. I know when I get off work, I'm late on Saturday nights. It's almost impossible to get a Lyft or an Uber now, and there's very minimal police presence. Are you guys aware of this? Is this a concern for you? And if you're not, is it possible to get police redirected to this area? And really, just in general, where have they been? So this is a question for the mayor. Some folks are wondering if there's been a lack of police presence around those areas.
Well, I live in Old City, so I mean, I don't concur with the lack of police presence. I see them. I'm not out late at night generally, so I can't comment on the condition of around Market Street when you go out. I know our police are working very hard in areas that are experiencing high crime. We're dealing with our gun violence issue in the 22nd district, the 25th district, the 24th district, and we're deploying our police to places where there's more potential for violence. I think a lot of times you see more homeless on the street now because there's less other people on the street, and most of the people on the street are generally unsheltered. So I think it looks as if there's more. Brian can correct me if I'm wrong, but we're about the same census that we normally have been. But I understand how people feel unsettled when they're in a situation where they're not sure how this individual is going to react because of mental health issues or those kinds of things. We can certainly ask the police to take a look at this particular strip and the streets around it. What time of night did you experience your situation?
Well, I'd say around 11, between 11 and midnight and that sort of thing.
Okay. I mean, I don't think I don't discount the observation, especially when I'm not out there 11 o'clock at night, so you are. But Brian, if you have anything to add on deployment.
No, I mean, I think we're deploying where crime is, to the mayor's point. And, certainly happy to take a look at the deployment levels in Old City. It's not going to be like a Friday and Saturday night in Old City was, and we're not going to deploy like it was, before things shut down, because we had thousands of people in bars and restaurants in Old City on a regular basis. And so you had pretty significant deployment throughout Old City. So we're now deployed like it's a neighborhood, because that's essentially what it is. And so we have not seen any significant upticks in crime in Old City, but certainly can raise the issue. On the unsheltered people, individuals specifically, there is absolutely concerns, and those concerns are valid. We've heard them in Center City. We have ongoing and severe concerns in Kensington, and obviously we've talked about the airport. And so there's no doubt that we have some problems and some challenges. We're actively looking at adding additional both emergency shelter beds and long-term housing solutions as we get through this crisis. And this crisis has exacerbated and added further stress on an already stressed system. So I don't think all of your observations are accurate. I feel comfortable with the police deployment, and again, to the mayor's point, happy to review.
And one of the things I want to raise, however, is this people suggesting that somehow we can solve our budget problem by reducing overtime substantially. most of the overtime that we experience are with police and fire. So if people are suggesting that we can solve our budget crisis or budget problems with reduction in overtime, they also need to say we're going to reduce police and fire coverage. So that's an important element in an individual's suggestion that that's how we solve our fiscal problem. You reduce overtime substantially, you're going to reduce police presence and fire presence in our city, and I don't think that's a good thing to do in the middle of this.
Okay, and Brian, just a quick clarification follow-up. So it's not just, I'm not just seeing this, right? This is pretty accurate so there is a actual reduction in the amount of police in that Center City, Old City area because of the reduction in people in general. So there have been less police there?
So on a Friday night in May last year, you would have seen multiple police officers on every block, right? Because you have literally thousands of people in bars. And it's one of the most densely concentrated areas for liquor establishments anywhere in the country. So no, you're not seeing multiple officers on every block because you don't have that same density of people. That's not to say that we're not deployed appropriately and to make sure that people are safe in that community. So I think that what I would ask you in your coverage is to say, yeah, we're not covering it the same way as when bars are raging on a Friday and Saturday night, but we are still having plenty of coverage for Old City and Center City for the current activity.
Okay, that's it for me. Thank you.
Thanks, Marcus. We're going to go now to Manny Smith at CBS 3.
Hey, my first question is for the health commissioner. So, following some reporting in the Inquirer today, to date, Dr. Farley, how many cases and deaths are linked from COVID are linked to nursing home facilities? And we hear that somewhere that number is north of 50%.
Yeah, 54%. It's 629 out of 1165.
And when that is the, all right, my second question is that you're already aware of the delay in state data yesterday. I know you talked a little bit before about reconciling city and state data. With those numbers kind of being irregular, have you heard from other health professionals or even business or other government professionals about their process moving forward when there's unreliable data?
I'm not sure what professionals you're talking about, but let me just talk a little bit about data. It's a lot more complicated than you might think to be able to come up with just a few numbers that we give here. We get data from many different sources, at least a dozen different laboratories. It comes in different forms. There are problems with the data stream every day. Most of it does not have information about whether the person was in a nursing home or not. And so there's a huge task that my staff does every day to look at that information, match up against multiple databases, try to discern if this was a nursing home resident or not, and to try to give you as complete a picture as possible. There was a period of time here when we knew that our information about whether they were a nursing home resident or not was incomplete. And so I stopped reporting that because I did not want to give you incomplete data. Right now, we're comfortable enough that it's complete enough that we have a graph on our website with that. But that's a huge task, and that's not a task that I think the staff in counties around the rest of Pennsylvania have the time to do, or the staff in Harrisburg. So it is difficult for the state to have complete information about nursing homes citywide. Yes, there is a problem with the data statewide, but in some defense of my colleagues at the State Health Department, it's difficult for them to have a complete picture at that level. It's a huge effort just for us at this level.
All right, thank you very much, Dr. Farley. My last question is a general administration question. We saw some other reports in media today that the Phillies are considering holding the second part of their spring training here in Philadelphia instead of going to Florida, and that there are discussions around using facilities not only at Citizens Bank Park, but also at FDR Park. Brian, is that something you're talking to the Phillies about? But I know the mayor's a huge fan. Maybe he's talking to Aaron Nola directly.
So I'm also a huge fan.
Yes.
We have had some very high level conversations with the Phillies, but nothing that we're in a position to talk in detail about.
I mean, it's gotten to the point where, you always want to go to a game, and we know we can't, assembling that many people is not going to happen for a while. And certainly probably not this season at all. But just to be able to turn on your television and even in an empty ballpark, watch two teams, professional teams play would be really fun. I want to make sure they're safe. want to make sure that people who work at the facility are safe, that we don't have any additional problems as a result of wanting to see a baseball game. But I would love to hear the umpire yell play ball.
So maybe spring training in Philly. I can say that. Yeah,
I was going to go to Florida before sometime in early mid-March, and that got scuttled. So
yeah, and Danny, I think my comment would be that's really a question for the Phillies, and certainly whatever opening we see is going to be governed by public health guidelines.
All right, thank you, guys.
Yep.
Kelly, we're not.
Oh, apologies. We're going to go to Madison Sychik now with Temple Update.
Hi. So my two questions are regarding SLIP. So my first question is, have you considered partnering with education majors from Temple or other universities in the area to volunteer their time for some of these summer programs for credit? And my second question is, what have you done to make sure that college students in the area know about this program?
Well, I'm not aware of that credit conversation. I'm not aware of. It's not a bad idea, and certainly it's worth exploring with our many universities and colleges. It's 285 jobs. This is a state, pretty much a state program run through this Department of Labor. Brian, if you have anything.
No, I'm sorry. We'll have to get back to you with more details.
Yeah, I'm not. Yeah.
Okay, thank you so much.
Thanks, Madison. We're now going to go to Leila Jones at Billy Penn.
Hi, hello. I have a question for Dr. Farley. Going back to what you were talking about antibody tests versus the PCR tests, why did you say that combining that data would be a mistake?
Well, because they measure different things. A PCR test tells you that you have the infection right now. An antibody test tells you that you had the infection sometime in the past. It could have been 2 weeks ago, could have been 2 months ago. And so it's really very different. And that antibody test is going to stay positive for, we don't know, but probably a long time. So especially as we go forward, let's say a year from now, if you had a positive antibody test, it would not be reflective or not known to be reflective of anything's happening then. It might be reflective of something happened a year ago. So for other diseases, we would not combine those two results. And so there's no reason we would do that here.
Okay, thank you. That's all for me.
Thanks, Leila. We're now going to move to our second round of questions, and we're going to go to Kevin Reardon of the Inquirer. Kevin?
Hello. This question is for Dr. Farley. The beginning of ramping up of contact tracing statewide. I'm interested in hearing what the status of the effort or the planning effort is in Philly, what it would take to, how many people it would take, how much training would be necessary, and what the optimum number of contact tracers would be to do the kind of, to follow the progress of the coronavirus once things are more open and more people are moving around. Is this something for which funding and protocols and an infrastructure already exists, or is this something that will have to be assembled? And if so, when will it be rolled out?
All right, so several questions wrapped together there, but let me try to answer. So we are building the infrastructure for that now and scaling up now. I can't give you numbers of contact tracers we'll hire because we're pursuing 3 models at one time. One model would be you doing this with our own staff. Another model would be working with a large organization like a healthcare provider organization, such as Penn Medicine, where they would interview their own patients and do the contact tracing themselves. A third model is we would partner with an organization that simply has a large number of staff or volunteers that could do this, but was not a healthcare provider organization. And we're exploring all 3 of those different models. The more that we work with partner organizations, plural, the fewer number of staff we need to hire. So I can tell you, we could hire anywhere from 30 staff to 200 staff, depending on what models we end up, or what mix of models we end up using. I can just tell you that we want to do this as quickly as possible, that we are piloting, working with a healthcare provider, Penn Medicine right now, as well as our own staff this week. And we'll learn more from that. And this will, we hope, scale up quickly over the next 4, 6, 8 weeks.
Is there money to pay for this? In other words, are there existing funds? Are there funds coming or that have been earmarked under CARES Act, or where will the money come to mount the kind of effort you need to have? So
Congress allocated money for testing and contact tracing. In the in the press around this, it was described as money for testing, but it really was testing and contact tracing. And so that money has wound its way to Philadelphia. We received a notice of grant award on that. And so we do feel we'll have adequate funding for the testing as well as the contact tracing scale up.
How much money?
The total amount for 30 months in that amount, that grant was $92 million.
Thank you.
Thanks, Kevin. We're going to go to Brian McCrone now of NBC 10 Digital.
Hey there. Basketball rims across the city remain down, and I wanted to ask, has there been any discussion about putting them back in place? And how does reopening, say, basketball courts fit in with reopening other physical aspects of parks and recreation centers like baseball fields?
Yep. So we're not reopened yet. So no, basketball rims aren't going to be put back up. And I think we're concerned about large gatherings of people. And so I think you're given the way basketball works and just the close interaction of people, I think it's likely that basketball rims will be one of the last activities that are replaced at recreation centers.
So forgive me if you've talked about this in recent days, but what about so if basketball courts might be moderate to high risk, where do baseball fields fit?
We haven't gotten to that level of detail, Brian, and I don't think we're prepared to get into that level of detail. I think we are continuing to work through guidance we have for both external and internal partners, and certainly as that guidance gets ready, we'll let folks know. But again, we're still in a red phase. We're still advising people to social distance, and we're not out of this. And I think that's really important. While things are a lot better, we're not done yet. We're still in the middle of a crisis, and we still need to manage through this crisis to get us out to the other side.
And we don't want to make October March.
Right. Okay. Very good.
All right.
Thanks, Brian. And that was our last call for questions. So seeing no further questions, we will conclude today's daily briefing and see you back here tomorrow at 1 p.m. Thank you.